Welcome back to our Bluesy Water channel. This video is directed mainly towards those who have worked with medical ozone therapy, but if you haven't or anybody's really delved into anti-microbial therapy, possibly rash people. Microbes, as we know, are very challenging. They're hard to get rid of, and they're very persistent. Think of a swamp with no energy movement. This is more Chinese. And a mountain stream, the mountain stream doesn't have microbes, the swamp does, so we get into this whole notion of energy sort of stagnation. You go deeper into energy literal freeze formation, and that's also opportunistic for pathogens, and that gets into what I call trauma freeze loops. But so an example of that is Crohn's colitis. Let's say somebody has Crohn's disease and the gut is seized and frozen. What's driving that trauma freeze? If you're coming from a Chinese medicine point of view and you say, well, the colon is grief, okay, grief indicates something. Why are you grieving? What's going on deep in the mind? Now you're getting into memory. So that's a very important thing I always like to include, because we seem to separate out that from disease. Some of us do. Some of us get it 100%, that if you have freeze patterns in the body, you can have pathogens. So our practices always touch upon energetic trauma freeze work, indirectly or directly. So we will post links below to our antimicrobial program, which ties into our trauma release program. So that's just something I want to say. Now, the therapies I'm going to talk about today, for those of you doing ozone, let's look at ozone real quick. Why is it such a vital therapy? And if you think of the fact that ozone is made with lightning strikes in a machine, so it's made from lightning, and now you're infusing that with oxygen. So you're putting this incredibly active field into the body. So it is the opposite of stagnation. It is incredibly volatile, alive, electrical energy. And pretty much in simplicity, that's why the therapy works so well on pathogens. And considering that you don't infuse that much, that you infuse, it's a short-term infusion, it's pretty miraculous what it can do in a short period of time. So needless to say, lightning energy, powerful healing. Okay, this is a second lightning field therapy I want to introduce. It's called electrical vortex medicine. Same thing. Only difference is you're in the lightning field. So it's like putting the lightning around your body and through your body, and you can do it for long periods of time. So anybody doing medical ozone therapy, instead of infusing the oxygen with lightning and then putting it in the body, now you can just be in the lightning. And the net result, by the way, in terms of my experience from a pathogen point of view, is that I'm personally doing way less ozone. So now, again, you can do this. You have to work up, and you have to be very careful. This is a practitioner assist therapy, and I'm reaching out to any practitioners who want to learn this, and I can teach you this therapy, especially if you're doing the ozone. Incredible 1-2 punch. You'll love it. You can get way better results. And ultimately, you can get your clients to go home and do both these therapies. If you're doing home ozone therapy and you're holistically inclined and you're doing some other therapies, we can give you a protocol to enhance your home practice. But mainly for practitioners, really want you to appreciate how you can segue from this electrical oxygen therapy to a pure electrical field therapy, put the two together and really do incredible work. Please contact me regarding this add-on for ozone therapy, and guaranteed you'll love it, because it's like, I think this is on the level or exceeds actual ozone therapy, mainly due to the fact of the ability to do it for a long period of time once you break in, and very much a cousin to ozone. Definitely, if someone's really compromised, the 1-2 punch, great combination, along with supporting, and this is key, the whole detoxification process. My email is andrew@bluesywater.com. Appreciate it, and look forward to talking with you. Thank you.